please post them or make use of the Q&A box, which is the question and answer box at the bottom of your screen. And as we cannot attend to raised hands, we encourage you to post your questions in the Q&A box. For other chat sessions, we kindly ask you to use the chat box for any other thing, comments that are not questions. And once you have attended at least 4 out of the 6 webinars in the series, and you've stayed longer for at least 60 minutes, at the end of the series, which is the end of the 6 weeks, you will be issued with a certificate. And then we have a simultaneous translation that is in Arabic and Portuguese. So please choose the language option at the bottom of the screen to access the correct translation. And also additionally, there will be a French session, same time every Thursday for the Francophone speaking countries. The presentations and all recordings will be available after the webinar series. After the webinar series ends, and on a weekly basis, they will be sent to the email that you used to join in. So without wasting much of your time, I would like to introduce the first speaker, who is Dr. Guy Mbayo Kakumbi, who is the Technical Officer for WASH and is in the Universal Health Coverage Healthier Populations Cluster at the World Health Organization. And Dr. Guy is going to talk to us about the waste management, the impact during the pandemic. Over to you, Dr. Mbayo.
Good morning, everyone. Shall I share my slide from this end, or you will be sharing them? Lizzie?
Kindly go ahead there from your side. Thank you.
Okay. Can you confirm that you are able to see my first slide?
You're sharing the second screen. Can you share the main screen?
What about now?
Yes, this is okay.
Wonderful. Thank you. Yes, good morning, everyone. Guy Mbayo, I work for the World Health Organization. I am based in Brazzaville, and from here I cover the whole region, the African region. So the purpose of my discourse today will be the burden of waste in general, but I will try to dive into what happened in healthcare waste, specifically when we had the pandemic. And for that, you have there the outline of my presentation. I will cover it following those pointers. Exposure to environmental pollution remain a major source of health risk throughout the world. Though risks are generally higher in developing countries like our countries, where poverty, lack of investment in modern technology, and weak environmental legislation combine to cause high pollution levels. Association between environmental pollution and health outcome are, however, very complex and often poorly characterized. Level of exposure, for example, are often uncertain or unknown as a result of the lack of detailed monitoring and inevitable variations within any population group. Exposure may occur via a range of pathways and exposure processes. Individual pollutants may be implicated in a wide range of health effects, whereas few diseases are directly attributable to single pollutants. Long latency times, the effect of cumulative exposure and multiple exposure to different pollutants, which might act synergistically, are all create difficulties in unraveling association between environmental pollution and health. Nevertheless, in recent years, several attempts have been made to assess the global burden of disease as a result of environmental pollution, either in terms of mortality or disability-adjusted life years. And that's how waste stands up on our way, or on the way of all environmental determinants of health. And poor waste management does affect air, water, soil, but much more also sight, smell, and physical integrity. And we say in our region, we could largely prevent the almost 29% of the total disease burden, which is due to the environment. And climate change come to play, it is even exacerbated. So I have there a diapo, this graph just to show the roots of transmission of most diarrheal diseases. And in our day-to-day life, crops, water resources, our fingers, and various surfaces are exposed to sanitation hazard. They would be unsafe toilet, unsafe containment of excreta, unsafe transportation, unsafe treatment, or unsafe use of disposal of excreta, and to several other hazardous events. Waste in general, when poorly managed, does adversely affect our health. And the most affected are usually children, and they are affected by lower respiratory infections or diarrheal diseases. But we know that older people are much more affected by non-communicable diseases. So I will not ask you what are the issues in your cities, but I believe you have many. Now, we conducted a study globally looking at several low-income or low and developing countries. And there we find that management of waste care, health waste care, is a problem. We could see from that assessment that 30% of healthcare facilities only had the basic healthcare waste management service. And in our sub-Saharan Africa, we were finding them more in hospitals than in other facilities. At least 50%, 54 to 55% of the hospitals had some sort of basic waste management services offered. We have more, we have additional information like 2 out of 5 healthcare facilities in Africa had the basic healthcare waste management. And there were not definitely, and that's a real problem, enough countries that gather data to calculate global coverage adequately. So there is an issue of data when we are talking about the burden of waste in our countries. And during the pandemic, you would remember it led to a double burden as there were an increase in waste, but also a reduced capacity of healthcare workers to manage the waste itself because there were more patients. And they were constrained, especially at the beginning. We were all taken by fear. And that modified our pattern of going to, resorting to healthcare. And as a result, indeed, safe management of healthcare also of healthcare waste suffered. Now, this slide shows you the list of items that were to be catered for as waste, but much more specifically, they were availed to many countries, even those that didn't used to have them. We had masks, gloves, gowns, SARS-CoV-2 rapid antigen test, testing cartridges, vaccine vials, vaccine needles, and all the packaging that come along. Many places that never had them finding themselves having them, which means boldly the volume of whatever comes in was raised, and therefore whatever needed to go out, that volume as well was raised. And in our record, during the pandemic, through the UN portals and UN arrangement that was made to support countries during the pandemic, we had close to 18,000 tons of masks that were provided, which means at the end of the day, at least 18 tons of waste we needed to dispose of with our means, our existing facilities and arrangements. So 60% that come from the same study, 60% of health facilities in the least developed countries are not equipped to handle existing waste load. And indeed, they were not equipped to handle adequately COVID-19 waste load. We were talking about, that is globally, close to 2,600 tons of non-infectious waste that were generated, mainly plastics, through the kits that we received, various kits. There were at least 700 and plus liters of chemicals that needed to end up as waste. And we had close to 144,000 tons of additional waste in form of syringes, needles, safety boxes, etc., that was linked to either normal administration of care or linked to vaccine services, vaccination services. Now, at WHO, when it comes to defining waste or waste management, we see all the schemes that are out there to first manage, handle, but also dispose of the waste. And that can include discarding them, destroying them, processing them, recycling them, reusing them, and eventually also controlling them. That could be in controlled landfills, for instance. But again, for WHO, the prime objective of waste management is indeed to reduce the amount of unusable materials and to avert the potential of health hazard, but also of environmental hazard that come along the way. So here you can understand that by planning, by purchasing, by requisitioning any item that you'll be using in your pipe to deliver services, you create waste automatically. And there are so many risks and challenges that are associated to waste management. We saw that during the pandemic. When we look at waste that is generated through household or domestic channels, we saw that there were an increased amount of mixed waste, which was including infectious waste due to the low level of segregation where they were generated. There were an increase of amount of plastic waste. there were a lack of inventories or estimates of the actual amount of household hazardous waste that was being generated. Littering increased, leave alone illegal dumping and open burning. In many countries, due to the curfews or due to the, how do you call this, when we close all our cities? Forgot the word. But many services related to waste management were just shut down. They were either suspended, that's the case for recycling, or even collection of waste. And there is a list of other risks, a list of other challenges that we faced with domestic waste only. But again, we also have similar risks and challenges when we looked at the waste management streams. We indeed have an increased amount of infectious waste that was generated. We had service interruption of healthcare waste management services. We had inadequate healthcare waste management treatments in place. We had the suspension of cleaning and orders. We had no sufficient capacity to indeed treat adequately and dispose of the waste. But though the beauty of the process was we didn't have to change much in our practices as such. We had new guidelines that was covering water, sanitation, and hygiene, and waste management, addressing specifically causes to COVID-19. But again, we had some baselines and documents that would guide our work. We had this overview of technology for the treatment of infectious and sharp waste from healthcare. Hello? We had self-management of waste from healthcare facility guidelines. And indeed, unfortunately, these slides just to show the way the situation is in many places and was and is still. We need to do some effort around this, but we know what is the general characterization of the waste we have from healthcare facilities. And that's what we think we need to be doing. We first need to minimize the waste at the origin, at the source where we generate them. We want to generate less. And we do that by ordering smartly our goods for the services we need to provide. We need to segregate them at the source and throughout the rest of the process. When it comes to collection, to transport, to storage, to treatment, to final disposal, we need to have different streams. One for general waste, for infectious waste, and for sharps. And in some cases, we can also have the same for radioactive waste and for chemical and pharmaceutical waste. We learned as well that in the process, it is pretty much very important to train the staff, health workers. They are key to all that happen, being to deliver health care, but also to handle the waste that comes along. And therefore, we think any country need to organize several types of training. One or several for medical and nursing staff, where they will be understanding what are the guidelines to follow in terms of classification, segregation, and in terms of general healthcare waste management. They need to be trained on infection control and prevention. Waste workers, cleaners need also to be addressed separately with adequate training on how to collect, how to transport, etc., and how to manage the waste itself. Administrators, those that are usually deciding on allocating budget, they need as well to be coached to understand which organizational and institutional arrangement needs to be put in place, how they need to accompany assessment to understand the magnitude of the problems, which waste we generate, how we can handle it, what we need, which budget, which human resources. Operators, when we bring specific new technology, especially, we need to train them on how to operate and maintain those equipment. Maintenance technician, similarly, they need to be able to repair them if they break down, as they will always do. Oh, I muted myself. I hope you have been hearing me. The way forward, we think, should be one where we really need to reduce the amount of unnecessary PPEs, for example, that are put at use in health facility. And that including the application of other infection prevention measures, such as hand hygiene. We need to use smaller quantities of packaging. And we need to develop and use the use of safely reusable and easily disinfected PPEs. We need to use PPE made with a greater proportion of renewable, bio-based, and recyclable material. We need investment in recycling system for general healthcare waste, and we need implementation of reverse logistics and centralized treatment of waste using non-burn technology. And indeed, we have to invest in local and regional PPE production and other product as well, like alcohol, etc., to enable to be timely available for services. So we need to reduce the waste, and for what that is not waste, we can prevent by using them rationally. We need to prepare, when it comes to waste, the way they can be reused, investing in safe and reusable products and proceeding with decontamination. We need to recycle, supporting those systems. We need to recover byproduct with recycled and biomaterials. And we need indeed to invest in well-managed landfills and waste workers. I will almost be going down, but still I think there is a value to waste services that are provided in healthcare facilities. Here I have listed a few examples of best practices and opportunities that can come around. But we know we can help preventing healthcare associated infections, saving health system costs, improving quality care, protecting health workers, users, and communities, and indeed increase health system resilience. And the way forward definitely would be recycling. And there we have example in Tanzania where hazardous and non-hazardous waste contains, we know they are valuable. They are valuable and they can provide income for hospitals. We had a project like that that was conducted very successfully in Tanzania. I wanted to share with you this slide would come from our guidelines, our WHO guidelines on sanitation and health. And with that slide, what I want to show is that sanitation can be a solution for several development goals, being it health, nutrition, security, equality, employment, environment itself. It's all up to us. If we can proceed with safe sanitation, then we will be able to collectively make the right effort and to provide a lot of advantage to our society. And to conclude, a systemic change in how healthcare manages its waste would indeed include greater and systematic scrutiny and better procurement practices. This is important. Many of those items that were procured during the pandemic, believe me or not, are still in our warehouses here and there. And there is a growing appreciation that health investment must consider environmental and climate implications, as well as a greater awareness on the co-benefit of any actions that are carried out. This would eventually require stronger national policies and regulation, regular monitoring, and reporting. Indeed, that should be coupled to accountability and behavioral change support. We need to develop the workforce and, more importantly, to increase budget and finances. We should definitely include waste management in our health budgets and invest in the recycling market. This is all that I have had for you today. I thank you for your attention and will be happy to take a few questions if times allows. Thank you. Lizzie?
Yes, thank you, Dr. Mbayo, for that informative session, and also some of the key issues that were coming out, issues pertaining to targeted training, issues pertaining to practical and scalable solutions that, and also the best practices and opportunities that can come around, and also giving some examples of how we can overcome the burden of waste management. And so without wasting much of our time, I'm going to invite our second speaker. The second speaker is Dr. Aziza Rangunwala, who is a medical scientist, and she works with an organization called Groundwork and is affiliated to Healthcare Without Harm and Center for Zero Waste and Development in Africa. Dr. Aziza is going to talk to us about overburden of waste management to zero. Afternoon, Dr. Aziza, and over to you. Thank you.
Hi, Lizzie. Afternoon, everybody. So without repetition of what Dr. Mbayo has presented on, I'll also be presenting on a different aspect of healthcare waste management in Africa. So if the sound is fine and you can all see my screen, we can start. And it's not Dr. Aziza, it's Mrs. Aziza. Thanks, though. So when we look at... No problem. So healthcare waste has never been afforded the priority it warranted, in terms of history, because when we look at waste We use what we need to utilize, and we just don't want to see it anymore. We want nothing to do with it. We just expect waste to disappear. And these are images taken from different healthcare facilities, some in South Africa and some in Zambia. And there's different types of waste containerization. As you can see, some are using boxes, some are using reusable containers. The color coding is very apparent, but also not very visible in all sectors, because there's a lot of it is just general waste. And with COVID waste, like Dr. Bio has said, it has increased a lot. As you can see, there's a mask there. The masks, the PPE has become way more than what, it has increased the waste generation rates. And as you can see, a lot of facilities do not have the storage space for these different types of waste. These are just more images on different color coding and the waste skips for recycling as well. So just to start, medical waste is also known as hazardous waste. It's referred to as healthcare waste. It's referred to as biohazardous waste, medical waste, clinical waste, hospital waste. There's different bodies that standardize how to classify waste. So these are the different classifications of healthcare waste. You have your healthcare waste, and then you have your healthcare risk waste, which has to be disposed of in a certain manner. And then you have your healthcare general waste that is non-hazardous. The non-hazardous waste can be recycled pretty easily without issues of legislation. Under healthcare risk waste, we have your infectious, your sharps, your pathological and anatomical waste, your body parts. You have your chemical waste, which is different from your pharmaceutical waste. And then you also have your isolation waste. Now, isolation waste is usually from your diseases such as Ebola. And at first, COVID-19 waste, people were not sure, is this isolation waste? Now, there's normally healthcare risk waste is 15% of the waste in a medical facility. But because of high volumes of this healthcare waste, because of no segregation, improper segregation, there's blurred lines in between the different classifications. And then you also get that a lot of departments filter, it's just hazardous waste, non-hazardous waste. There's no different categories for chemical, pharmaceutical, pathological, etc. And then a lot of places exclude radioactive waste from your healthcare waste definition, because it needs specialized lead containers, and appropriate government agencies need to treat it, to make sure they use membrane technology to bury it deeply underground. I won't repeat what Dr. Bauyo said about the COVID-19 healthcare waste. It has increased the waste burden significantly. Our PPE, our test kits, our vaccines, sanitizer, and the amount of medication. In the beginning of lockdown, our quarantine sites in South Africa, the food waste was also treated as medical waste. And that costs a lot of money. So we do look at what impact it has on the environment, but cost-wise, it's a very big issue because the healthcare waste management system was already strained before COVID-19. And now, during COVID-19, we're still part of the pandemic, During this COVID-19, it's showing that we do not have the adequate resources devoted to the safe and sustainable management of COVID-19 related healthcare waste. And there have been different classification debates on the COVID-19 waste. Like currently, we have our vaccine vials. mRNA vaccines are not infectious at all. They can literally, but obviously because of how occupational health and safety standards are, we have to ensure the safety of the patient, the safety of the planet, and the balance between the two is quite tricky. So when we look at healthcare risk waste, we're looking at, Dr. Mbayo had a nice summary of what health issues that waste can contribute to directly. And we look at the health of the planet. It pollutes air, it pollutes soil, your vegetation, your water. Our water filtration systems, even in the first world, water filtration systems do not filter out pharmaceuticals. In countries, first world countries like Germany, there is high doses of Viagra in the water. A lot of antibiotics don't get their half-life because people also flush pharmaceuticals down into the sewage system, and that is problematic. And we also need to think about how healthcare waste contributes to climate change. I mean, it contributes to the burden of disease. It's an occupational health and safety risk. The nosocomial diseases, many medical professions can attest to those as well, because it can harm your health workers, your patients, visitors, employees of contractors, and the public. So when we think about healthcare waste as an issue, it links directly to the Sustainable Development Goals. It has direct links to the first 8 I mentioned, and an indirect link to number 9, which is industry, innovation, and infrastructure. So the Sustainable Goals it's directly linked to is good health and well-being. Where healthcare waste is improperly disposed of, there is no good health or well-being. Dr. Mbayo mentioned the illegal dumping sites, the open burning fire. Clean water and sanitation. We are a water-scarce continent. This year is the year of the rains, El Nino, so we do have the risk of floods, which is also a result of climate change. And we have an ocean where desalination is very expensive. We can't use the water from the ocean because desalination is such an unsustainable way of purifying water. We're also looking at affordable and clean energy. When we look at disposal, when I'm going to speak about incineration later on, because incineration is mostly how healthcare waste is treated in Africa. We're looking at sustainable cities and communities. Where can we recycle? Where are we having a full circular economy and not a linear economy? Responsible consumption and production. As mentioned, I mean, for emphasis, I'll repeat some things that out of emphasis that Dr. Mbayo has mentioned. We cannot purchase from people that do over packaging, that use excessive amounts of plastic. And the way we handle our healthcare waste is so important in climate action. Sustainable Development Goals number 14 is about the ocean. There's a lot of raw sewage in the ocean. There is a lot of masks being found in the ocean, a lot of plastics and microplastics. And this is evident in when you look at sustainable fishing practices as well. We end up eating the fish that swallow all these plastics. And then there's also about life on land and biodiversity. Our interference with nature is what causes pandemics. And our interference with nature, waste is one of the biggest ways we interfere with nature. So when we look at the African context, we are in the second populous continent, but well, the first most aesthetic looking continent, I think. We have 67,740 health facilities, more or less, in Africa. And this is probably growing now because we're having a lot of COVID centers as well. And these produce, for 2013 data, 282,000 tons per annum. And this is 2013 data. In 2022, we can safely say that this has, if we get the right data, the correct data, where data is being recorded, I am sure this number has probably doubled by now. So a lot of African countries are signatories to conventions, the UN conventions, the Basel Convention, the Rotterdam Convention, Stockholm Convention. The Minamata Convention is one that's also been ratified very recently, and it's about the elimination of mercury products. So a lot of mercury thermometers, mercury is a very, very dangerous element. And a lot of blood pressure thermometers that we also speak about. Mercury contamination is so important. And then we also have the United Nations framework on climate change. Now, a lot of our healthcare systems are underfunded. There's a lack of infrastructure, and due to shifting of priorities in the health system, waste usually doesn't get the funding it should get, because we need to have our medication. Our public health system is overburdened. But at the same time, there's lack of sanitary landfills. There's an increased use of crudely designed incinerators. And globally, there's 180 million tons of hazardous waste that's generated around the world every year. And 9.3 million tons actually the waste moves from country to country. And that's one thing Africa is also a victim of. It's a victim of other countries using Africa as a dump site for all their waste, which is one of the unfortunate things that has happened is happening to us, but obviously there's something we can do about it. So there's a lot of training and awareness needs and policy and legislation gaps, throughout Africa. So a lot of our challenges with healthcare waste is general, but it's also contextual, to the African context. Like, for example, we have Eritrea, Lesotho, Ghana. There's no legislation for healthcare waste management. And then you have certain countries are signatories to certain conventions, but there's also no national guidelines in place. And we always have issues of political instability, so that when we're trying to standardize what we're trying to do, there's trade union pressure, there's pressure from multinational medical companies. I mean, a lot of pharmaceutical companies don't care whether they send you the expired medication that's about to expire in 2 months. What you do with the unused medication is up to you. We don't have buyback policies built into this. And a lot of this, there's also a lot of mismanagement of funds within our health systems and lack of efficiency in the public sector. And this is actually a global issue. It's not just in the African context. Now, the access of rural population to municipalities is also an issue, because a lot of our rural population, there's no infrastructure for treating healthcare waste. A lot of the waste gets transported to treatment facilities. And a lot of times, big companies would just try and use dumping sites or illegal dumping. And there's many open dumping sites throughout the continent, and it's a huge health and safety concern. There's a lack of monitoring systems as well. And our generation rates differ significantly. So, for example, Batna, Algeria, has 1.72 kgs generation rate per bed per day. But the national average is 0.72. And the general standard would be about 1 kg per bed per day. And obviously this would differ because of the disease burden. How much more waste? Are you having more bandages? Are you using more needles? Are you using more drips? And we found that the highest generation rate is in Ethiopia at 6 kgs per bed per day, which is significantly higher. So we're not seeing a trend in our generation rates as a continent, because even in Algeria, which is one country, you see big spikes in generation rates. So when we're managing healthcare waste, Dr. Mbayo spoke about the improper handling, transportation, and storage. It has to be handled accordingly, transportation by licensed transporters, for example. And there's lots of different legislative bodies, but ultimately we're working on the polluter pays principle. Now, the polluter pays principle means that the generator accepts complete financial liability for the safe and legal handling, storage, transportation, treatment, and final disposal of the waste that they generate. So we call it the cradle to the grave management. But what we're trying to do is eliminate the need for a grave. What we need to do is avoid. But in the health sector, we can't avoid creating waste. And if we can't avoid it, we should minimize it. If we can't minimize, we should recycle or reuse. When can we recycle and use? That's something we can discuss as well, and dispose of in a manner that's environmentally friendly. So healthcare waste can be improperly treated, buried, burned, or dumped, and it will always affect the most vulnerable populations. So if we look at how it's treated currently, so placenta and amputations, it's either buried or placed in a pit in a lot of instances. According to legislation in South Africa specifically, it has to be burned. And it's incinerated using locally constructed incinerators with minimal or no control technology. There are other thermal processes like an autoclave, or there's also, but those have biogenic carbon emissions. Landfills, on the other hand, have methane emissions. And are we going to offset our fossil fuels for energy generation? Because a lot of these incinerators just incinerate the waste and that's it. It's not being used to heat the hospital. It's just being, goes for pollution. And then obviously, like I mentioned, the emissions from long distance transportation. We have trucks and trucks on the road transporting waste, from different provinces, different countries, even different continents, via air travel. So with even when incineration is controlled, for the same amount of energy as a coal-fired power plant, incinerators release so much more toxins. Dioxins and furans double the carbon dioxide and carbon monoxide, 6 to 14 times more mercury, 6 times more lead, and more sulfur dioxide. And this is a photo of a very old incinerator. You can see if people who work there are also not protected against the emissions from these incinerators. And a lot of environmental departments don't always monitor and ensure that these emissions are below a certain air quality level. So this, according to the healthcare waste categories, according to WHO, there's different treatment and disposable options. There's obviously your incineration makes it first. You have your autoclaving, your microwave treatment, plasma gasification, and the other types of waste treatment options are not necessarily green or sustainable options. But if you look at how chemical waste should not be treated the same as pharmaceutical waste, so they all have different, when you look at needles and syringes, you don't want needle stick injuries. So there's a balance between occupational health and safety and also being sustainable in your waste management practices. So then there is so much more than just incineration. And on this list, it's a very long list, but it's heat, thermal processes, chemical processes, and there's even biological processes. We have biogas from food waste that hospitals have been trying to implement in their hospitals. Part of this research I did on alternative treatment on healthcare waste is because currently we don't have standards for alternative treatment. It's a new type of avenue to step into, but it's also something we have to look because of water usage, electricity usage of these different types of microwave systems and when I go on to the next slide, the alternative treatment can be done on site. So this one picture I took is at Netcare Hospital, where they built outside the hospital a little mobile home. And they have this little machine using chemical and shredding processes to dispose of the waste. That's the first, the pictures in the first line. The second line is actually one of our healthcare service providers working on imported technology from Italy using microwave and frictional heat treatment, where they render the waste. You're supposed to not recognize the waste before taking to landfill. That's one of the conditions of alternative treatment of waste. So this is obviously looking at ways of going away from incineration. And even the hospitals that, want to start managing their own waste and have these incinerators, they can look at this as a more sustainable way, because having an on-site incinerator negates the need for, you're making the people sick who are coming to you. And that's the problem with, not when the medical fraternity says do no harm. We forget that the waste we generate in medical facilities does do a lot of harm. Now, the impact of the poor waste management has always fallen disproportionately on the poverty-stricken communities that have little or no influence on the waste products being illegally dumped near their communities. Now, the healthcare sector needs climate action. So obviously, Incineration is low implementation, low cost, more simple to carry out, but there's also a need for change. And they found that color coding and recording the seals is good to prevent the negative impact of healthcare waste on the environment. So we need a sustainable waste management system to provide a more circular economy within the African continent. So when I speak of sustainable healthcare risk waste management, we're looking at how do we make sure it's okay for the planet, it's cost effective, because in a capitalist society, in a capitalist system, there is no resources to just expend for no reason. So we need to look at what would work for us. How will this cost? Is there economic variables dealing with the bottom line and the cash flow? I mean, we're looking at how much can we spend? We're looking at the people, the community that you're engaging, looking at equity, the health, the well-being, and the quality of life. Is it sustainable for the planet? Are we looking at the natural resources like the water and air quality, energy conservation and land use? So these are all different types of things we could look at for creating a sustainable healthcare system. And one of the projects I run for Africa is called Global Green Healthy Hospitals. And a lot of hospitals have started looking at how they can implement green projects. So some have committed to reducing their healthcare waste because it's always the low-hanging fruit. Waste is the low-hanging fruit of how you can green your facility. And it's always, well, not the easiest. It's actually the most complex, but it's something that you can see results faster with. And then just to look at our future steps, we need to prioritize the safe and environmentally sound treatment. Where feasible, we should be microwaving, autoclaving, and use steam treatment, integrating with internal mixing or chemical treatment. And at the same time, we have to make sure that the chemical we're using to treat the waste is also environmentally friendly and not going to pollute your water system, your soil, or have any repercussions on the environment. So we have to have in your comprehensive waste management system clear outlines of roles and responsibilities. We need to make sure that we have where we can have resource allocation for handling and disposal of healthcare waste. A lot of healthcare facilities need special storage rooms for the waste. Now, a comprehensive waste management system is a long-term process, and it's sustained by gradual improvements. And the first is to introduce legal and institutional frameworks specifically designed for healthcare waste. Each place should have a healthcare waste policy, and a healthcare waste policy should be accompanied by a healthcare waste implementation plan. And that's how we define climate smart healthcare waste systems in the bigger mix of things. And that's it for me for today. If there are any questions, we'll take questions afterwards. Lizzie, over to you.
Thank you, Ms. Aziz, for a very, very informative session, and also getting to shed more light on the cradle to grave concept, the types of waste, and also how we can look at sustainable healthcare waste management systems, and also having a look at the future steps on how we can get to minimize waste. Thank you so much for that. And for now, we are just going to have a healthy break so that we can give the interpreters time to rest our voices before we move on to our next speaker, who is going to be sharing with us a country experience of how they've been handling waste during the pandemic. So for the health break, we are going to share a video with you. I'll kindly ask my colleague, Briette from ICAN, to share the video for the health break. Over to you, Briette.
Thank you, Lizzie. I'm going to start sharing now. Are you aware of the medical waste generated during the pandemic? How does that impact your health? And what can you do to reduce this medical waste?
We're not able
Hello
to see
and
the
welcome to
video.
Science in 5. I'm Vismita Gupta-Smith. We are talking to Dr. Margaret Montgomery today about medical waste. Welcome, Margaret. Let's start, Margaret, by please describe for us what this medical waste is that has been generated during the pandemic.
Medical waste is all the waste.
We are only seeing your screen with the files.
Okay, let me just share the other screen. Sorry.
All right, thank you.
Okay, let me know if you can see it, please.
Yes, now we can see it.
During the pandemic.
Perfect.
How does that impact your health, and what can you do to reduce this medical waste? Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. We are talking to Dr. Margaret Montgomery today about medical waste. Welcome, Margaret. Let's start, Margaret, by please describe for us what this medical waste is that has been generated during the pandemic.
Medical waste is all the waste that results from vaccinations, from testing for COVID-19, as well as for caring for patients in healthcare facilities and homes. So this is vaccine needles, vials, testing reagents, testing swabs, as well as all the personal protective equipment that health workers are using, such as masks and aprons, as well as carers and the patients themselves. In terms of the scale, it's massive. We've all seen discarded masks on the streets, and in 2020 alone, 4.5 trillion additional disposable masks were thrown away by the public, resulting in 6 million extra tons of waste. In our own analysis, looking at the extra waste loads at healthcare facilities, we found that it increased by 3 to 4 times during this pandemic. And in facilities that didn't segregate their healthcare waste, the increase was 10 times greater, which really shows that segregation is very important because only 20% of healthcare waste is infectious and hazardous and requires extra care and treatment. At the same time, we know that 1 in 3 healthcare facilities globally before the pandemic lacked ways to safely segregate and treat waste. And on the sub-Saharan continent, this is 2 in 3 healthcare facilities. So we have the combined double burden of already weak systems for waste management, coupled by the fact that health workers are extremely overburdened with increased patient loads and can't manage the existing waste, let alone extra waste.
Maggie, as you just described, medical waste is not a new problem. Talk to us, please, about the health impact, the impact on our health as well as our planet's health of this medical waste.
There's many adverse impacts from unsafely managed and treated healthcare waste. So needle stick injuries cause many hepatitis B and C infections every year. There's also other infectious pathogens that are spread through bandages and other infectious waste, some of which are not treatable through existing antimicrobials. There's also all the dangers that are involved with burning waste, and in particular, plastic can lead to the release of dioxins and furans, which are carcinogenic and can really harm not only those working in healthcare facilities, but those vulnerable communities that surround where healthcare waste is being burned. Lastly, there's a lot we don't know about plastics in the environment, and increasingly we're finding that microplastics are showing up in our waterways and our food systems. These are all concerns about healthcare waste.
Maggie, just the scale of this problem seems so huge. What can we do as individuals to reduce this medical waste?
There's 3 main things the public can do. The first is to become aware and take it as your personal responsibility to understand the amount of waste you're generating and how you can reduce those volumes to begin with. So for example, gloves are not needed in many situations. So reducing things that aren't needed can reduce volumes of waste. The second is to be a conscious consumer and actively seek high-quality reusable PPE. And in particular, in high-income countries, increasingly we're finding that very high-quality reusable masks are available, and those would be preferred. In places where high-quality reusable masks aren't available and disposables are the only option, it's also important to think about recycling these masks. And increasingly, we're finding that recycled masks are being put to use to make roads and other building materials. Lastly, the packaging. It's really important to try to seek products that use more ecological packaging and paper-based packaging instead of plastics. And I also just want to emphasize that the government also has an important role by creating and implementing strong healthcare waste policies that are backed by regular budgets and financing, in supporting the recycling sector, so all that waste that isn't infectious can be put to other uses, and lastly, in investing in high-quality, locally manufactured PPE, which not only can reduce carbon emissions from transporting goods long distances, but it can also help fulfill commitments that were recently made around low-carbon and sustainable health systems. So in short, we can no longer afford to ignore the impact on the environment. The good news is it's possible to prevent and protect against COVID-19 and the environment, and I call on each of you to do your part.
Thank you, Maggie. That was Science in 5 today. Until next time then, stay safe, stay healthy.
Thank you so much, Priyat, for the video. Which is also summarizing what our presenters were already shared with us today. And so we move on to our third speaker for today. I'd like us to welcome Mrs. Cheleka Kazia, who is the Assistant Director and the IPC National Focal Point at the Ministry of Health in Zambia. And she's going to share with us the Zambian experience on how they've been handling waste during this pandemic. Mrs. Kazia, welcome and over to you.
Thank you so much, Lizzie, and good afternoon. Don't know whether it's morning that side, but good afternoon to everyone on the call.
Good afternoon, you may proceed.
Thank you. Thank you, Lizzie. Welcome to the presentation on the country experience on healthcare waste management in Zambia. I've already been introduced. I'm Cheleka Kazia. And the presentation which I'm going to do will be in 4 major parts. I'll look at the introduction, and then the journey of healthcare waste management in Zambia, where we are coming from, and other sub-components, and then the gaps, the way forward, and the conclusion. That's the presentation outline, which has already been highlighted. Next slide, please. Zambia has a population of about 18,380,000, with 10 provinces, 116 districts, and a total of 1,915 healthcare facilities. And this also includes the private healthcare facilities. Next slide. Healthcare waste management is a key standard precaution in infection prevention and control. Poor healthcare waste management poses a risk to healthcare workers, patients, surrounding communities, and indeed, indiscriminate disposal of healthcare waste equally has a negative effect on the environment. To reinforce the implementation of proper healthcare waste management, Zambia has a national healthcare waste management plan, which is updated every 5 years and when need arises. This has further been strengthened by the implementation of infection prevention and control during the COVID-19 pandemic and international agreements and resolutions, some which have already been highlighted by the second speaker, Madam Wazeza. Next slide. Just as a part of the introduction, Zambia has an active water, sanitation, and hygiene in healthcare facilities coordinating committee, of which one of its key responsibilities is resource mobilization, technical support, capacity building, among others. The committee meets quarterly, but the frequency of meetings has increased in the recent past due to the COVID-19 pandemic. The committee has been very instrumental in ensuring that WASH and IPC, which includes healthcare waste management interventions, are executed in healthcare facilities. Next slide. At this point, we'll talk about where we are coming from so that we know how we've progressed even during this time of the pandemic. We are coming from an area where we had inadequate staff trained in healthcare waste management, inadequate segregation of waste at source, and inadequate color coding and labeling of waste receptacles, inadequate or inappropriate final healthcare waste disposal facilities, inadequate environmental friendly technologies of final waste disposal, inadequate application of the 3 R's, which is waste reduction, recycling, and in-use in healthcare waste management. And also, an assessment was done in 2019 for healthcare facilities, which reviewed the 64% of healthcare facilities sampled complying to healthcare waste management standards. This percentage usually fluctuates because another assessment was recently done. What are the international agreements or resolutions strengthening the management of healthcare waste in Zambia? We have the Stockholm Convention, which was also highlighted by the second speaker, which aims at promoting the best practices and techniques for healthcare waste management with the aim of minimizing or eliminating releases of unintended persistent organic pollutants. And this also makes reference to the dioxins and the furans which are emitted during the time of incineration. Also accelerating the implementation of water, sanitation, and hygiene in healthcare facilities as per the resolution of the World Health Assembly 2019. You may be aware that Zambia hosted the global event to speed up the implementation of WASH in healthcare facilities in September 2019 in Livingstone, where issues of healthcare waste management were equally primed. And that is from resolution to revolution. That was the theme for the assembly. Next slide. Where are we right now? During this pandemic, we've had healthcare workers and support staff being trained in healthcare waste management with support from partners and also incorporated in IPC trainings. We've had 60% of healthcare workers trained and 10% of support staff. Here you can see that support staff, the number is quite low, and we aim to increase the number of support staff who should be trained in healthcare waste management. We've also had the National Technical Guidelines on Healthcare Waste Management, which have been reviewed to include the best available technologies and best environmental practices like the issues of autoclaving and shredding. We've also developed the standards for washing healthcare facilities, where standards have been for healthcare waste management have been incorporated as a response to the global call to accelerate the implementation of WASH in healthcare facilities. And we've also updated the healthcare waste management plan because the healthcare waste management plan just had different color codes which never included one which deals with highly infectious diseases. We had the black for general waste, the brown for pharmaceutical waste, the yellow for infectious waste, but we've included the red for highly infectious waste. Next slide. Remember, even in the where we are coming from, even now, we've had the problem of segregation of waste at source. Even the previous speakers talked about this. What is happening now is that we put up posters And these are being supplied to healthcare facilities to support a segregation of waste with support from the partners, like the color codes, which I already talked about. Next slide. We've also accelerated or intensified technical support in the healthcare facilities, starting from the point of where waste is generated from, that is in the wards or any place where the health services are being provided. Next slide. We've also constructed, or with support from partners, high temperature incinerators, those which can afford the burning rate of about 850 degrees Celsius, like the one which is just being shown there, and it is with support from CDC and the Association of Public Health Laboratories. This is just an example of one of the incinerators which are coming up right now. Next slide. We are talking about environmental friendly ways of waste disposal. We are also promoting the use of non-incineration methods in response to the Stockholm Convention on persistent organic pollutants. That's autoclaving and the shredding of waste at Kabwe Central Hospital with support from UNDP and Global Environment Facility. This is also one of the pilot sites where this project was being piloted. Next slide. We've also been supporting healthcare facilities with posters, just as I highlighted in the previous slide, which acts as reminders to posters on color-coded bins and also type of waste. And we're also promoting the public-private partnerships as a strategy of waste management. We are linking up with people who are able to recycle the waste masters and the manja pamozi. But the challenge which we have again here is the issue of mixing the waste. Where the infectious waste and the general waste is mixed up, then that cannot be taken up by our partners because immediately it becomes infectious waste. We equally have the legislation, which is the Environmental Management Act number 12 of 2011 and the Public Health Act, and also the Solid Waste Regulation and Management Act number 20 of 2018, among other legislations, which also support us or contributes effectively to the management of healthcare waste, like the issue of the polluter pays principle, which is highlighted in the Environmental Management Act. And also, as Zambia, we are reviewing the Public Health Act. So there's a chapter on healthcare waste management, which has been incorporated to just specifically look also at the penalties of the poor management of waste at the point of generation. It's also in line with the polluter pays principle. Next slide. We can now look at the tools used to monitor healthcare waste management. We've had the individualized rapid assessment tool and the wash fit, and also the assessment tool for washing healthcare facilities, supported with one of our partners when you're looking at also the standards for washing healthcare facilities. And with this, we've come up with the IPC scorecard, which is helping us to monitor the issues of IPC, infection prevention and control, in the wards. And healthcare waste management has been added in the STEM scorecard. It is a digitalized scorecard, which helps also the issues of self-assessment. Next slide. Despite the strides made towards improving the management of healthcare waste, the recent interaction review of the COVID-19 response, which we held with support from the World Health Organization, revealed some gaps which require urgent attention. Well, the first one is inadequate final waste disposal facilities, and also the mixing of waste at waste generation points as a big problem, also as highlighted even by the previous speakers. This is one of the areas which needs much attention. Next slide. We'll now look at the way forward. We are saying we'll still continue with manpower, training and retraining, development, and also focusing on our support staff. We have little of our support staff. The percentage is quite little who've been trained in healthcare waste management. And yet they play a very important role when it comes to waste management. And also mobilization of resources. We'll continue with the issues of mobilization of resources and also monitoring, mentorship to ascertain compliance to healthcare waste management standards, and also partner support in healthcare waste management, especially when it comes to final waste disposal facilities. And also we'll continue with self-assessments by individual healthcare facilities so that healthcare waste management could be improved at generation points. Next slide. Use of the multimodal improvement strategy. This has already been introduced and we have to strengthen it, where we have to look at system change, making available system change factors to facilitate implementation, like the issues of infrastructure when it comes to healthcare waste management, the final disposal facilities, the human resource, the training of healthcare workers, and also other key role players and also support staff, supportive supervision, monitoring, also having in place mechanism for reminders like the poster, which I had earlier on presented on color code so that it aids also the issues of segregation, which is a very big problem. And also institutionalizing the culture change or safety climate to make intervention routine, championing and role modeling at all levels. Also making sure that people do their own self-assessments. Next slide. What are we saying in conclusion? We thank the government of the Republic of Zambia, cooperating partners, and stakeholders for the support in accelerating the implementation of WASH and IPC in healthcare facilities, which includes healthcare waste management, which is a very important standard precaution for IPC. And we are saying we'll endeavor to prime the implementation of the 3 R's: waste reduction, waste recycling, and waste reuse. And I remember one of the presenters talked about the cradle to grave, but we are saying cradle to cradle. What you call waste can be a useful resource to make another product, especially when there's effective waste segregation at source. So we'll look also at the reduction in the use of the plastics. And finally, we call upon partners on this call to support Zambia realize the dream of accelerating WASH and IPC in healthcare facilities. I submit. Thank you so much for listening to the presentation. I end the presentation. Ziko mutwatotela, twataizia, twalumba, asante sana.
Thank you so much, Mrs. Kazia. A very, very detailed presentation. And I hope most of us have learned 1 or 2 things, and we are going to adopt to our country settings, especially on the implementation of the 3 R's in waste care management and also the 3 M's. And without wasting much of your time, we've now come into the question and answer segment of today's presentations, and seeing that we have some questions in the chat box, I will kindly ask my colleague Briette from ICAN, who is going to lead us on the Q&A session. And I'll first ask the first question, which is coming from an anonymous attendee. They are asking, how do you test for the performance of the incinerators to ascertain that all biohazard wastes are completely burnt to avoid reinfection? So over to you, presenters.
Okay, I'll answer the one on incineration. So generally, to ensure that there was destruction of waste, they do test the ash to make sure. But usually with the incinerators, if they reach certain temperatures, the environmental unit would usually say that this is how that temperature should kill. In a lot of medical waste, if you put it out in the sun will actually kill it. I know that's not a very professional thing to say, but that's actually for looking at infection control, how it's also measured. But there are usually control vials put into these systems.
Thank you, Aziz, for that wonderful answer. Any of the panelists or presenters that they have additional?
Yes, I might add for this question on the incinerators. Normally, the incinerators, when they are manufactured, they are set to operate at a certain temperature. And it's only if they reach that temperature that they will be efficiently eliminating or reducing the waste. Now, if it is those imported devices, you will find monitors, a monitor that will show you the temperature that your chambers have reached. And if it reaches during operation the indicated temperature, it operates well. And therefore, it should do what the supplier has advised it could do. That one. Secondly, it is also advised to put those air monitoring stations in the vicinity of the incinerators that you are operating, and that taking into account as well the direction of major blowing winds. And then you could monitor certain number of parameters, particles, presence, absence of pollution in the neighborhood. And that can also indicate to you that, yes, the burning is done well, and it is the air that you are breathing around there, it is, according to WHO guideline on air pollution, it is at this level or such other level. Thank you.
Thank you so much, Dr. Mbayo and Ms. Aziza, for those answers. Our next question is directed to Mrs. Kazia. One of the participants is asking if you could elaborate more on the 3 R's and the 3 M's that you spoke of in your presentation. Over to you, Mrs. Kazia.
Yes, for the 3 R's, for waste reduction, indeed, we have to look.
If you could elaborate more on the 3 R's and the 3 M's.
Thank you. For the 3 R's, I think it related to waste reduction. We indeed, like for instance, during this time of COVID-19, there should be rational use of PPEs. That is one. And also the reduction in the plastics for general waste, even for general waste in the healthcare facility. Instead of using plastics, you can use something which you know that you can reuse again. That is part of also the waste reduction technology. And also waste reuse. You use things which you can maybe even sterilize and reuse again in the healthcare facility when it comes to equipment. And like something which you throw off as waste. And then for recycling, it's also good to link up with our partners when it comes to issues of waste, waste recycling. Like how I gave an example of the waste masters and other people who will be able to even buy the waste from us and use it in another potential resource, like the issues of hang wires. We've had Majapamozi and waste masters who've done good recommendable work in terms of buying the general waste from these healthcare facilities and coming up with buckets the hang wires, the other things, products, which are very good, unlike going to a landfill. Because again, going to the landfill, we are not doing well because we'll just end up, congesting the landfills. Even the lifespan of the landfills would be reduced. And in other ways, when it comes also to the issues of, I think I've said enough. Is it clear on the 3 R's?
Yes, thank you so much, Mrs. Kazia. It's very detailed. And just
Maybe I come to
follow
the 3
up
M's.
question.
Maybe I come to
Yes.
the 3 M's.
Yes, you may. Please go ahead.
For the 3 M's, we looked at manpower. Manpower in healthcare facilities. We have to invest in training and also retraining our healthcare workers and our support staff. That was one. It's key because if at all they are not trained, waste will not be handled well. It will be something in our, at our generation points. And also waste in terms of mobilization, we need to invest actually in healthcare waste management. Waste, why should we invest? We've heard even from the previous presenters that this is very, very important. We have to look at systems which can also help us to, employ the 3 R's, which I talked about earlier on. Monitoring and mentorship, very important to ascertain compliance to healthcare waste management practices. I think that's where I ended in terms of the 3 M's.
Thank you so much, Mrs. Kazia, very detailed. And just a follow-up question on the assessment tools that you discussed on. Are they available online whereby some of the participants in the call are expressing that they would love to have them, maybe possibly to adapt to their local settings?
I'll be able to share with you, and then you can share with the participants.
Thank you so much for that. And at this point in time, I would like to thank our presenters for today, Dr. Mbayo, Ms. Aziza, and Mrs. Kazia. This has really been a very informative and exciting session. And thank you to all the other panelists who are on the call. Thank you to the interpreters, and also a special thank you to the participants who joined today on this call, and those that are streaming live from Facebook. And we're looking forward to having you again next Wednesday at the same time. And our topic for next week is personal protective equipment. And then for the French webinar, please, for those that speak French or understand French, you can also log in same time on Thursday where the similar topics from today have been shared. Thank you so much, and we hope to meet next week on Wednesday. Keep safe and continue raising the IPC flag high. Thank you so much. Thank you and over. Bye.
Recording stopped.